Hello everyone, welcome to your first lecture on the respiratory system. In this lecture, we will cover these objectives. This is a brief outline of what is going to be covered in this lecture. So let's talk a little bit about anatomy of the respiratory system. What is the function of the respiratory system? Why is it important? Well, it's important because it helps us with ventilation. What is ventilation? Breathing in and breathing out, basically. In goes the good air, which is oxygen that we need, and out goes the bad air, which is carbon dioxide. It also is used by our body for vocalization, with your larynx and your voice box. And then we have olfaction, which is the part of our respiratory system that helps us to smell. Now, the respiratory system obtains oxygen from the atmospheric air. It transports through the respiratory tract, goes to the alveoli, and ultimately diffuses the oxygen into the blood to carry oxygen to all the cells of the body. Now, this is achieved through ventilation, that is basically movement of air in and out of the airway, breathing in, breathing out. And inspiration, which is breathing in, inhalation, that's transport of oxygen to the alveoli, to get exchanged with carbon dioxide. And expiration is the expelling of carbon dioxide. Now, the respiration is the process of actual gas exchange between the atmospheric air and the blood, and between the blood and the cells of the body. That's the difference between ventilation and respiration. Ventilation is just breathing in and breathing out. Respiration is the actual process of gas exchange, which happens at the level of the alveoli. Now, what are the major regions of the respiratory system? Let's look at each very briefly. The upper respiratory tract. This includes your nose. This is the passage for air to pass to and from the lungs through the nasal mucosa in your nose actually helps to humidify and warm the air to room temperature, and it also traps dust and organisms. So this actually detects odors, irritating dust that provokes sneezing. So this helps. It's our primary defense, one of our primary defenses. Then we have the paranasal sinuses. As you can see in this picture right here, you have the different sinuses. Now, these help with speech, and they're a common site of infection. And we're going to cover rhinosinusitis, which is, infection of the paranasal sinuses in our next PowerPoint. But this is a very common site of infection. Also in the upper respiratory tract, we have the pharynx, tonsils, and adenoids. Their tube-like structure connects the nasal and oral cavities, divided into nasal, oral, laryngeal. It guards the body from invasion of organism entering the nose and the throat passageway for the respiratory tract and digestive tract. So once again, these are also our primary defenses against infections and pathogens, infectious agents. The upper respiratory tract also includes the larynx, which is your voice box. The larynx connects your pharynx and your trachea. It consists of the epiglottis, the glottis, thyroid cartilage, the stricoid, arytenoid cartilages, and your vocal cords. This is a picture of all of those different parts. Please review these a little bit more in detail. Download the PDF so you can look at those. Then also in the upper respiratory tract, we have the trachea, the windpipe. This is a smooth muscle with like C-shaped rings right here. See these C-shaped rings? This helps to prevent the trachea from collapsing. It serves as a passageway between the larynx and the right-left main stem bronchi, which is right here. As you can see, this connects right here from your throat. That's the trachea. It connects your, upper part of your respiratory system to the lower part of your respiratory system. And these are your bronchi over here. So it enters the stem of this trachea over here. It enters into your bronchi through the little hilus, and those connect right here and right here in your lungs. So next, we're going to talk about the lower respiratory tract. And like I said, I'm breezing over this really fast because this is just the anatomy part of it. Please look over it, become familiar with the terms used to describe different parts of the respiratory tract. What is in the lower respiratory tract? This consists of the lungs, the bronchial structures, and the alveolar structures. And what's the function of it? Is gas exchange. So it delivers oxygen to the tissues through the body and expels waste gases, for example, carbon dioxide, with expiration. Now, the circulation of that oxygenated blood, it depends on the cardiovascular system. So the lungs oxygenate the blood, and the cardiovascular system perfuses the body with the oxygenated blood. And we will talk a little bit more about the role of the cardiovascular system next week when we are talking about that system. So let's look at the lungs here. You have the right lung, which has 3 lobes, upper, middle, and lower. Then you have the left lung that has 2 lobes, just the upper and lower. Each lobe is subdivided into 5 segments, and these are separated by fissures, extensions of the pleura. The pleura, what is the pleura? It's a serous membrane lining of the thoracic cavity. It lubricates the thorax and the lungs to allow for smooth motion during inspiration and expiration. Because remember, when you're breathing, your lung is expanding and going back down. And so the entire area has to be lubricated so that can happen smoothly. So the visceral pleura, it covers the lung, and the parietal pleura, it covers the thoracic cavity. The mediastinum is the middle of the thorax between the pleural sacs and extends from the sternum to the vertebral column. And here are some pictures of all of those different parts of the lower respiratory tract and mainly the lungs. Please take a look at those. Then we have the bronchi and the bronchioles. We have in the lower bronchi, 3 in the right lobe and 2 in the left lobe. And you have then to the terminal bronchioles and then the alveolar duct and sacs. And alveoli is where the exchange of oxygen and carbon dioxide takes place. This is the level. If you notice here, there's a picture showing the entire section over here. See the bronchioles, and then you see the terminal bronchioles, and then you see the alveoli down here. Those are those little tiny sections right here. So this is where the actual exchange of oxygen and carbon dioxide takes place. There are 300 million alveoli, and there are 3 types. Type 1 is 95% of the alveolar surface is type 1. Type 2 is only 5% of the alveolar surface, and they produce type 1 cells and they produce surfactant. So the surfactant actually reduces the surface tension and improves lung function. Then we have type 3, that is the macrophages. They provide defense by ingesting foreign matter. So now that was just a brief explanation of the anatomy of the upper and lower respiratory tract. And as I mentioned, please go back and please look at the PowerPoint in detail. And if you need to brush up on your anatomy, you can refer to your textbook. And also I have in your winter review, I had a anatomy and physiology book over there. You can also look in there to brush up on your anatomy of the respiratory system. Now let's talk about the regulation of breathing. So this is basically the physiology of the respiratory system. So once again, ventilation is what? It's just air moving in and out. Breathing in, breathing out. Inhalation, exhalation, inhalation, exhalation. Respiration is the actual exchange of carbon dioxide and oxygen. So the oxygen in the blood, in the lungs, it diffuses to the rest of the body through the cardiovascular system. Now, another term that you should be familiar with as well is acid-base balances. This is the exchange of carbon dioxide and oxygen in the lungs and the renal secretion of bicarb to maintain the body's pH between 7.35 and 7.45. Now, you will cover more on acid-base balances in block 2, but it's good to just be familiar that, okay, this is a process that happens in the body, and the respiratory system, it has a role in it, right? Then you have speech, movement of the air through the vocal cords, allowing for vocalization and speech. Sense of smell, movement of air through the nose allows the individual to smell odors in their environment. Then we have fluid balance. The respiratory system also plays an important role in fluid balance. Water is excreted as water vapor through the exhalation process. When you're breathing out, we exhale, basically we are excreting water. Inspiration and expiration. Here, this PowerPoint goes over a little bit more on the inspiration and expiration. What happens during inspiration? During inspiration, the phrenic nerve is stimulated and causes a contraction, which causes, diaphragm to go lower, and expansion of the chest cavity. As you can see over here, it causes the expansion of the chest cavity. There's a decrease in the pressure of the lungs below the atmospheric pressure in the air. Now this helps the air to rush in to our lungs. Then during expiration, after that happens, when we're breathing out, the diaphragm relaxes. This decreases the size of the thoracic cavity, and it causes an increase in pressure within the lungs that exceeds the atmospheric pressure. This causes the air to passively leave the lungs because now you have increased pressure in there, so it pushes the air back out when in expiration. So once again, just to briefly review, what is respiration? It's the exchange of oxygen and carbon dioxide at the alveolar level. Each alveoli is covered in a capillary membrane. It carries deoxygenated blood returning from the systemic circulation. Now, this will make a lot more sense to you once we cover the cardiovascular system as well. So basically what's happening is that, the deoxygenated blood that your body has used already goes back into your heart. Then the heart sends it to the lungs to get oxygenated. And how is it getting oxygenated? But through respiration, right? So during respiration, the gas exchange happens, and the carbon dioxide, we breathe it out, and the oxygen goes into the blood and sent to the heart, and then the heart will send it to the rest of the body to perfuse. And this cycle just continues again and again and again and again. And this is basically called oxygenation and perfusion or circulation. All of these are different, parts of this. So let's move forward and let's talk a little bit about dead space. What is the dead space? These are areas of the tracheobronchial tree that don't participate in gas exchange or respiration. There are 3 types. You have anatomical, alveolar, and physiological. Then we have the shunt, where this is the blood that does not participate in gas exchange, or blood that returns to the left heart without being oxygenated. There are 2 types, anatomical and physiological. You'll hear about ventilation perfusion mismatch. So what is this? Now, this is when you adequate ventilation with poor perfusion. Your ventilation, you're breathing in and out, right? But your perfusion is not the best, right? So that's when you get a high VQ mismatch. A low VQ mismatch is when you have adequate perfusion, but you have a poor functioning alveoli. So the gas exchange isn't happening very well, but the blood is getting perfused. So you have low, oxygen, less than what you need in the blood. This can occur with pneumonia. So the high VQ mismatch can occur with pulmonary embolisms. That is when you have a blood clot in your, lungs. And a low VQ mismatch occurs with pneumonia. And once again, the dead space in shunt, it results also, that's the space that's not involved in gas exchange, can also result in a ventilation perfusion mismatch. This is a diagram that kind of shows how the atmospheric air, which is we have about approximately 21% of oxygen in the air that we breathe in. So when we breathe in, it goes from, the entire passage right here all the way down to the alveoli, and then, back out in expiration. Please also go over this concept map on oxygenation. What is oxygenation? Oxygenation is the transportation of oxygen to the cells and the carbon dioxide from the cells, leaving the body, right? Then what do we need for this to actually happen? You need a requirement. You need an adequate functioning respiratory system. You need the ability to inhale and exhale. You need adequate perfusion for the gas exchange to happen. And you need adequate neurological function. You need an efficient cellular metabolism, including, your hemoglobin. So in order to, for this, how do you know that you have adequate oxygenation? How do you know that the person's oxygenation is fine? They're alert and oriented. They're breathing fine. Their oxygen saturation is greater than 74%. Their arterial pH is between 7.35 and 7.45. Those are your acid bases. Then you have your skin color is within normal limits, like, normal for your ethnicity. Cap refill is less than 3 seconds. Your hemoglobin, you have an adequate amount of hemoglobin. This tells you that the person's oxygenation is fine. How do you know if the oxygenation is inadequate? You're going to notice altered mental status. You're going to notice respiratory distress, respiratory failure, hypoxemia, anoxia. And these are all alterations in your oxygenation. Then medications. What are the medications that we use to help our patients breathe better and improve their oxygenation? You have oxygen, we can administer oxygen. We can administer bronchodilators to open up the lungs. We can administer inhaled corticosteroids, long-acting, beta agonists, short-acting beta agonists, anticholinergics. These are all the different allergy medications, because allergies might be what triggered the inflammation and sometimes make it difficult for people to breathe and get oxygenated. So these are different things that, medications that people take. And then what are the different therapies that we use? We can use deep breathing exercises, repositioning the patient, always if the patient is having difficulty breathing, we need to always put them in a high Fowler's position. Then you can provide suctioning to, take out any extra secretions in the airways. Nutrition management, hydration, incentive spirometer use. We always encourage patients, especially after surgeries, to use the incentive spirometer, because it helps to exercise the lungs and helps them to, go back to their normal breathing patterns. Then we have, administering oxygen. We do oxygen therapy, and we're going to practice oxygen therapy in skills lab this week. And then we have pharmacological therapy, the medications that we talked about. So please go over, the priority assessment cues, the priority labs that we do for, promoting oxygenation, lifespan considerations, and fundamentals. We focus on the older adult. So, please focus on what are some age-related changes that the older adult sees in their respiratory system. Okay, well, that's it for the first part of your respiratory system lecture. And please go ahead and listen to the next part and fill out your disease process maps. We're going to cover different diseases of the upper respiratory system and the lower respiratory system. And I will see you in class.